if we look at renal cell carcinoma, I mean, there's been huge advances in the treatment of metastatic disease. We saw amazing 9-year updates from the Checkmate 214, where this tailed the curve and like 30% of patients may be cured, which is crazy. But ultimately, at the same time, we know that our best chance for cure is going to be that perioperative setting. And so a lot of efforts have been made to improve care in the adjuvant space. Pembrolizumab had been shown to improve disease-free survival, and we had an interim analysis showing improvement in overall survival. So at the meeting this year, we actually saw extended follow-up, and it would, at 5-year follow-up, which continues to see the overall survival benefit absolute right around 7%. So I think it really reinforces that pembrolizumab is a standard of care. But as we look at the data, there's different approaches one can say. One can say, well, there's some patients who are maybe never recur, but I would also argue there's some patients who, despite pembrolizumab, still do recur. And how can we do better, right? How can we sort of further optimize the treatment while mitigating toxicities? And so that's the basis for the STRIKE trial. So we know that in the metastatic setting, immunotherapy with a VEGF TKI is a standard of care with much higher response rates than monotherapy with PD-1 alone, anywhere from 50 to 70%, depending on the trial. And so that's an unmet need and hasn't been studied yet in the adjuvant setting. And so that's what we're looking at, is all patients receive pembrolizumab who've had resected high-risk disease, sort of akin to the KEYNOTE-564, and then patient randomized get pembrolizumab alone with or without 6 months of tivozanib, which is a very well-tolerated VEGF TKI, with the hope that that short course of TKI, 6 months, will not impact quality of life significantly in the long term, while at the same time synergize with immunotherapy to lead to higher cure rate and fewer recurrences. And so that's now open through the Alliance and through the NCTN. I would encourage anyone who is a member to consider opening it.